Hi, I'm Dr. Clive Gallagher. I'm a plastic and reconstructive surgeon based in Indianapolis. So the topic of this video I'm very passionate about, lip feminization or lip enhancement. And we're going to talk about what are the techniques we can use for both our trans feminine patients, which also apply to our cisgender women as well. And what the goal is really to take your natural lips, we're not going to distort anything, but take what you have there already and enhance it. So make it fuller, but doing so naturally. And the goal is really so that you look better with lip gloss if you want to do that, but also what our patients love with these techniques is they can wear full lipstick if they want. They can do that bold look, and their enhanced lips really carry it a lot better. We're also going to talk about the differences for our more mature ladies. Sometimes there's a difference in technique is needed for that group as opposed to the younger girls. Larger, fuller, luscious lips are in right now. They have been. I don't think they're going anywhere. And so we're going to talk about different techniques available, such as fillers, and then moving along to surgical options. We're going to start first of all by just reminding ourselves what those differences are between masculine thinner lips and what signifies to the brain a more fuller feminine look. So the differences between masculine lips and feminine lips, firstly, the most obvious difference is volume. And so we're able to really help this along with our fillers. Also, a couple of other differences, usually the upper lip is 70% the size of the lower lip, and there's also a more pouty, kind of protrudent appearance to the lips. So this lip enhancement was done with just filler alone. The patient has had a few different sessions. So she probably has quite a bit of product in there just in the upper lip, and we can really achieve a nice pout with this. This was just using Juvederm in the office, and you can see it changes the face quite a bit. In this patient, again, this was just at her first session. Juvederm only applied to the upper lip, but it helps make the lips fuller and softer and more appealing and feminine looking. So next we're going to move on to talk about surgical techniques for lip enhancement. So one of my very favorites, which not many people know about, is what's called a lip lift. This is a very quick and easy procedure. It can be done in the office, usually just a few days of downtime. But let me tell you what's pretty cool about it. So when you train to be a plastic surgeon, one of the most fascinating things I loved about my training was, when we're learning about craniofacial aspects of plastic surgery and aesthetic plastic surgery, what's considered to be beautiful, you begin to, or lots of things are pointed out to you that you probably didn't notice already. So you get to, in a sense, deconstruct what is considered to be beautiful. So what we're going to talk about, which is specific to lip lifts, is what's called incisor show. So fun fact, it is attractive that when your mouth hangs open to be able to see some of your teeth, your incisor teeth. So this is called when the mouth is in repose or when it's hanging open. You want to be able to see some of your incisors. And this is because, believe it or not, as the face ages and everything begins to come down, the upper lip lengthens and eventually that incisor show disappears. So oftentimes you'll notice it in models, they'll pose like that, showing off their incisor show, which should be a few millimeters. So what that lip lift does is it helps restore some of that incisor show, and subconsciously the brain will pick up on that as a sign of beauty and youth. So what the lip lift can achieve is it can show off both those teeth and the vermilion of the lips. And again, it's fascinating. You'll begin to notice this a lot on models. These are two Victoria's Secret models. Is they have that appearance of beauty and youth because you can see all that teeth. And in fact, this incisor show for some of these girls is kind of the upper limit of normal. But again, because the brain associates it with youth, we think it's quite beautiful. 3 millimeters, nothing wrong with that. But unfortunately, as you age, that incisor show begins to go away completely. So this is the procedure. It's quick and easy, and all we do is take some skin out from underneath the nose. The patient can go to sleep if they choose to do so, but oftentimes patients do very well wide awake in the office where we numb this area up completely. We take away a certain amount of skin and close it up with some stitches, which will need to come out in about 5 days. You do look like you've had something done for about the first week, and then there's red marks left behind for about 2 to 3 weeks after that. So you'll expect to be back to normal in about 1 month after this. And here are some results. This is why it's such a powerful procedure, and you can see that incision underneath the nose pretty much disappears. You can cover it up with some concealer in about a week, but again, you have that more youthful appearance, seeing the teeth, and also an increase in that vermilion show, so you have a fuller upper lip. And here's another appearance of a patient, younger patient, but this really did enhance and feminize the patient's lips and improve vermilion show. This can be done by itself, of course. It's never really covered by insurance in our experience, or it can be done as part of a more complete facial feminization. If it's something you're interested in, check out our website, www.universitygenderaffirmationsurgery.com, where there's lots of pictures on there. Our blog is on there, lots of good information for both our transmasculine and transfeminine patients. And of course, you'll get our consult page is on there. It's usually the fastest and most reliable way to get in touch with us. Thank you.